describe what an ICU nurse is and their role on the healthcare team?
As an ICU nurse, I work in the intensive care units of the hospital. We care and provide round-the-clock care and monitoring for critical ill or dying patients. ICU nurses are a vital link between the doctors and the families, and we relay patient information and updates to the families from the physicians themselves. We provide education and support to the family members with decisions such as discontinuing life support or deciding the next step.
What is an ICU unit and what type of patients go there?
Seriously ill patients require close observation and monitoring, especially trained nurses care for 1 or 2 patients at a time each shift. Patients in the ICU may have special equipment in their room depending on their condition. The equipment in the ICU may seem overwhelming. Patients are connected to machines to monitor their heart, blood pressure, and respiratory rate. Ventilators, which are breathing machines, assist some patients with breathing until they are able to breathe on their own.
What is a typical day like for an ICU nurse?
Just like most nursing shifts, ours are 12 hours, either from 7 a.m. to 7 p.m. or from 7 p.m. to 7 a.m. I like to go in early in order to look at the assignment sheet and to see who my patients are. This way I can get a better understanding of my patients and to also see if I have any questions for the off-going nurse. We then get reports from the previous nurse.
Giving report is when the nurse going off of a shift exchanges and relays information to the oncoming nurse.
We typically have around 2 patients. Reports typically include patient name, weight, date of birth, admitting diagnosis, precautions, health history, and report is especially important because these patients usually cannot talk, but they need more attention and care than a patient who is outside of the ICU.
When assessing neuro, you would ask questions such as whether the patient is alert and oriented, are their pupils dilated, and is the patient moving all of their extremity. In the cardiovascular system, you go over things such as heart rate, blood pressure, and whether these are in normal ranges. There is respiratory, and this is important in the ICU because a lot of patients are ventilated. Things covered would be what their ventilator setting is at, and if their oxygen saturation is normal, or whether or not the patient is receiving respiratory treatment and what their breath sounds are sounding like. In the GI and GU section, you talk about the patient's feeding and if they have a feeding tube, their bowel sounds, if they are able to stool, or whether they have a Foley catheter which can monitor their hydration status. Then for the skin section, you talk about any wounds or surgical incisions, whether or not the patient has a dressing, or if they are undergoing any wound treatments. We are looking to make sure there isn't any skin breakdown, and also if there are any creams or ointments being applied to those. The last section is psych and social. This would be any names of important family or social workers, or if there are any family situations that we should know about that could be essential to the patient's health.
Sometimes it is best to evaluate the condition of your patients before caring for the first one you are assigned. I like to prioritize my more critically ill patients first. Introduce myself to the families if they are there. Different doctors will come to assess patients, and you work with these doctors to answer their questions they may have about the patient.
What is the work environment like?
Critical care nurses should be prepared to work long hours. They must be able to adapt to sudden changes. They work in emergency rooms, critical care wards, walk-in clinics, and even doctor's offices. Workdays include rotating 12-hour shifts, weekends, and holidays. This job may also be physically demanding, requiring a lot of standing, lifting, bending, and stretching.
Can you list the steps and educational requirements for becoming an ICU nurse?
First, obtain an education in nursing. You can get this in 2 years, but most hospitals nowadays require a BSN, which will take 4 years. After you get through nursing school, you can take the NCLEX, which will get you a state license. Critical nursing is one of the harder nursing fields, so it is recommended that you gain some nursing hands-on experience elsewhere before moving on to becoming an ICU nurse. Entry-level nurses oftentimes work medical surgical floors or in skilled nursing facilities.
Are there different types of ICU units?
Yes. NICU stands for Neonatal Intensive Care Unit, and are for newborns who need intensive care after birth. PICU stands for Pediatric Intensive Care Unit and is for children up to the age of 17. There are also coronary care units, which are for patients with heart attacks, unstable angina, cardiac dysrhythmia, and, in practice, various other cardiac conditions that require continuous monitoring and treatment.
What do you find is the most difficult part being an ICU nurse?
You must be able to handle stress well and working in high-pressure situations. Also, critical care nurses should be prepared to work long hours and deal with life and death situations on a daily basis. ICU nurses should be proficient and confident in a wide variety of high-level nursing skills. The skills learned in nursing school should be applied, but makes it even harder because many times you'll be caring for someone who is fighting for their life. Also, these nurses should be experts in evaluating critically ill patients. They must be able to adapt to changes in environment, patients, and recognize complications. Nurses should possess critical thinking skills. Excellent teamwork, multitasking, and interpersonal communication skills are essential for an ICU staff, as is the ability to rise to challenges and stay calm under pressure. Many nurses find an ICU career rewarding because they play a key role in helping to save patients' lives.
What kind of equipment would you find in an ICU?
Monitors are something always found in the ICU. Patients are always hooked up to them through wires in order for the healthcare team to monitor them. Cardiac and heart monitors are also known as EKG or ECG. A pulse oximeter monitors the saturation of oxygen in the blood. IVs are catheters or tubes that are inserted into the veins to administer fluids, medication, nutrition preparations, and blood products. Patients in the ICU often have multiple IVs. A ventilator is a machine that helps patients breathe when they cannot do so themselves. Urinary catheters continuously drain the bladder and allow them for accurate measurement of urinary output, which is extremely important in fluid management and assessing kidney function. A crash cart is used in hospitals is a set of trays, drawers, shelves on wheels containing emergency and medical equipment at the site of a medical emergency.
What is the average salary of an ICU nurse?
$62,000 to $75,000 is the median.